The FDA has given the go-ahead to Johnson & Johnson for its single-dose COVID-19 vaccine.
Dr. Marc Siegel here to tell us how it works, how it's different from the others, and what it means for the fight against COVID. Doc, great to see you as always. Let's pop up the full screen comparing these various vaccines. You have the Pfizer at 95% effectiveness at preventing COVID, Moderna 94%, and Johnson & Johnson, updated number there, 85%. But over the weekend, Dr. Fauci came out and said, look, don't compare these vaccines. And that doesn't make a lick of sense to me. If I'm one of your patients and I'm going to ask you, which one should I take, Doc? Which one is better for me? Isn't that a normal question for us all to be asking?
So that is one of the questions, and it's actually one of the questions I was asked on the Faulkner special last night, which you're going to ask me about in a minute. And the answer is, Todd, that it actually depends on several things, and I'll tell you what those things are. Number one, the J&J vaccine doesn't work as well if you're over 65 and you have diabetes or you're overweight with underlying conditions. So that's one thing. The other thing is, I think overall, I would say that the Pfizer and the Moderna vaccines have been proven to give a higher degree of efficacy, in other words, more effective at 95% and really safe. And the other point is that we've given them to almost 70 million people already a shot, and that's a huge amount of people that we can say took this shot safely. So I put them at the front of the line. But Todd, I want to say two things that you're not expecting. One is the J&J is the only shot that's been tested for one shot. So for the people out there who are only going to get one shot, are going to say, I'm not going to take more than one shot, this has been proven to be very safe, and it decreases hospitalization and death by 100%. So that's really, really, really good. It's a very effective vaccine. It may be that the second dose of it brings it up to the level of the Pfizer and Moderna. They're actually studying that now. And last point, I, as a primary care physician, Todd, and that's half of the vaccines in the country are given by doctors like me. I can put it in my refrigerator for 3 months. Right. I can lay it out on the ledge waiting for the patient. Guess what that means? That means that I can use the J&J shot in my office, and that's the one I'm probably going to get, and I'm very excited about it, and I can use it to overcome vaccine hesitancy in a lot of people who wouldn't have taken it.
And then quickly, before I get to the next topic, is this going to be, or do we know yet, is this going to be something that we have to take every single year, or is it going to be something that we've built immunity up to for longer periods of time, or do we know?
Ashley, that's a great question, and we talked about that yesterday, too. And here's the answer to that. It's probably, we're very conservative, as you know, in the medical establishment. It's probably going to be last more than a year. It's looking very good right now that the immunity will last more than a year, maybe 2, maybe 3. And if we have to give a booster, it's because variants are emerging that we want to cover better. My personal belief is it's going to be more than every year, probably every 2 or 3.
And then, Dr. Siegel, as far as recapping America Together, that was with Harris Faulkner, her special last night, The Shot. Part of that special looked at why communities of color are resisting the vaccine. Tell us what people's main takeaway needs to be from this.
I think that there's been 400 years of mistreatment of the black community by the medical establishment. I think that involved the Tuskegee experiment with the United States involved in that. I think that there's a long memory of that, distrust, and the way to overcome that is one-to-one. As former Surgeon General Jerome Adams has told me repeatedly, if you want to care about what I say, first show that I care about you. And the other thing is that that's a powerful statement. I got to care about you if you want to know my knowledge. And the other thing is that the religious communities have to be involved with this because they're very involved on a daily basis. I'm not saying they have to give the shot, but a lot of times minorities will get information not just from their doctor, but from their community and from their church.
All right, Dr. Marc Siegel, thanks for being up with us early this morning. We appreciate it.
My pleasure. Thank you, guys.